Anxiety disorders are defined by persistent and intrusive feelings of fear, nervousness, and excessive worry. Illnesses like GAD, panic disorder, SAD, and specific phobias are all part of this category. Physical manifestations such as palpitations, perspiration, and shakiness are common among those who suffer from anxiety disorders. Whereas generalized anxiety disorder is characterized by an abnormal preoccupation with mundane everyday events, panic disorder is characterized by extreme, unexpected terror attacks that are accompanied by bodily symptoms such as racing heartbeat and difficulty breathing. Those suffering from seasonal affective disorder often avoid social situations out of extreme fear. Mood disorders, depression, manic depressive disorder, and cyclothymic disorder are all examples of mood disorders. Sadness, despair, and a lack of interest in formerly pleasurable activities are hallmarks of depression. Symptoms of bipolar disorder include manic episodes characterized by elevated mood, increased energy, and impulsive behavior, as well as alternating periods of depression and mania. The mood swings in cyclothymic disorder are less extreme than those in manic depressive disorder, but they still interfere with everyday life. Psychotic disorders. There are disruptions in perception, behavior, and thought processes in people with psychotic disorders like schizophrenia and schizoaffective disorder. Hallucinations, delusions, disordered thought processes, and impaired social functioning are hallmarks of schizophrenia. When depressive or manic symptoms are added to those of schizophrenia, the result is schizoaffective disorder. Eating disorders, those who suffer from anorexia, bulimia, or binge eating disorder have distorted views of food, their bodies, and their weight. Symptoms of anorexia nervosa include an unhealthy fixation on one's body shape and a severe reduction in food intake. Binge eating and subsequent purging behaviors like vomiting or excessive exercise are hallmarks of bulimia nervosa. Overeating without regulating one's portion sizes is a hallmark of binge eating disorder. Substance disorder, addiction to narcotics, alcohol, and prescription drugs are all part of the spectrum of substance disorders. Despite negative consequences, compulsive drug seeking and use characterize addiction. Developing a tolerance to substances, experiencing withdrawal symptoms, and having impaired judgment are all outcomes of substance disorder. Personality disorders, persistent patterns of thought, emotion, and behavior that are harmful or dysfunctional and go against societal standards, are the hallmarks of personality disorders. Narcissistic personality disorder, antisocial personality disorder, and borderline personality disorder are a few examples. Relationship instability, impulsivity, and extreme emotionality are hallmarks of borderline personality disorder. Neurodevelopmental disorders, intellectual disability, attention deficit hyperactivity disorder, and autism spectrum disorder are all examples of neurodevelopmental disorders that impact social, behavioral, and cognitive functioning, and usually show symptoms early in life. Disabilities in social interaction, communication, and repetitive behaviors are symptoms of autism spectrum disorder. Hyperactivity, impulsivity, and inattention are symptoms of attention deficit hyperactivity disorder. Trauma disorders, acute stress disorder and post-traumatic stress disorder are two of the many trauma disorders that can develop after exposure to disturbing experiences, such as violent acts, sexual assault, or catastrophic accidents. Reliving traumatic events through intrusive memories, flashbacks, nightmares, avoidance behaviors, and elevated arousal is what PTSD is all about. Autism spectrum disorder manifests similarly, but it often goes away on its own within a month following a traumatic event. Obsessive-Compulsive Disorders, repetitive actions or mental processes carried out in reaction to intrusive thoughts, are hallmarks of obsessive-compulsive disorder. The distress and disruption caused by obsessive-compulsive disorder can be substantial. Repetitive rituals like washing one's hands, checking, or counting might be compulsions, while common obsessions include worries about contamination, safety, or symmetry. If you enjoyed this video and found it useful, please subscribe for more videos like this.